Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all who seek to learn more about it. In today's video, we're going to talk about the concept of major depressive disorder and a major depressive episode. Now, before we get into this, it's important to understand that the DSM-5, which is the manual we use for assessment and diagnosis, has made some significant changes to the different subtypes of disorders. So just to give you a sense of it, although I'm going to have separate videos, there's persistent depressive disorder, which is now a fusion of dysthymia and mood conditions combined. We have a premenstrual dysphoric disorder, and we have a disruptive mood dysregulation disorder. These reconceptualization and added unipolar mood disorders are important. And as I said, I will have a specific video about that. But as I also alluded to, the focus of this video are major depressive episodes and major depressive disorders. So without further ado, I will go into that for you. So if we were to look at unipolar depression is a depression without a history of mania or manic episode. Now, I think it's important for us to appreciate that we use the term depressed probably too frequently, because all of us go through periods of time where we might experience sadness or periodic mood swings, but depression is a persistent condition. It's longer lasting than the day-to-day blues one might experience. So I also mentioned this to you, that there were some significant changes to the DSM-5. So it used to be that bereavement was excluded as criteria for major depressive disorder. It's no longer an exclusionary criterion. It actually is a contributing factor to major depressive disorder. In terms of substance and medicated induced mood conditions, no changes, or other specified depressive disorders, no changes. But I also mentioned that major depressive disorder, if it's a chronic subtype, and dysthymic disorder were merged into this new disorder, a new category called persistent depressive disorder. And we added premenstrual dysphoric disorder and disruptive mood dysregulation disorder. And then we added other specifiers. So when we think of diagnosing unipolar depression, what are the criterion? The first criterion is that a person has to have at least one major depressive episode. And to have a major depressive episode, you have to have, more often than not, depressed mood for at least 2 weeks or longer for majority of the day. And it could also include, but doesn't necessarily have to include, decreased enjoyment or interest in most activities. So notice depressed mood and or anhedonia, plus an additional 3 to 4 symptoms such as weight changes, appetite changes, sleep changes, irritability, fatigue or lethargy, feelings of worthlessness or guilt, concentration problems, and suicidal ideations or a plan or even an attempt. So all of these criterion have to be met. So if you look at number 1, where it says major depressive episode, you're going to have 1 to 2 features from that bullet point alone. And then if you look at it where it says 2 for the same 2 weeks, 3 to 4, depending on whether you had both features in number one or just one of them in number one, you're going to need an additional 3 to 4. So in total, you need 5 symptoms of depression for at least a 2-week period of time. You also need for a second criteria is to have no moments or periods of time where you had a manic episode or a hypomanic episode. That's important because then we might have to consider bipolar depression, and we can discuss that in another video. But mania is an exclusionary criteria for just a single depressive episode or major depressive disorder. Now, in general, when you have these features, they're going to cause significant distress. They're going to interfere with one, if not more, aspects of a person's life. So they're pretty debilitating when you think about it. And when we conceptualize the disorder, there are 5 domains that depression targets. So it's going to target a person's emotion. It's going to target their motivation, their behavior, their cognitions, and their physical essence. Now, just because it targets these 5 domains, it's also important to understand that there are individual differences. So one person's expression of depression is not going to be the same as another person's expression of depression. But let's get a sense of what these features look like. So when we talk about emotional symptoms of depression, you're going to look at sadness, feeling empty inside, being miserable, humiliated, decreased pleasure in life. And there's this phrase called adhedonia, where a person loses the ability to derive pleasure altogether. We also have a second set of symptoms that tap into a person's motivation. So a person may lose their drive or initiative or spontaneity. And when a person feels that they're not being productive, they can have increased hopelessness. And what we see based on these patterns is anywhere between 6 to 15% of people with a major depressive disorder die by suicide as a solution to their problem. From a behavioral point of view, we see less activity, less productivity. A person's speech will slow down. It'll take them longer to do activities. It will take them longer to get out of bed. Now, it's very important. What we're talking about here is you're awake, but it's a burden to even like get out of bed, lifting the covers off your body and standing up, taking a shower, things like that are like carrying a big boulder on your shoulder. So we see people with depression, they spend a lot of time in bed, trying to get out of bed or returning to the bed because of just feeling down. From a cognitive point of view, cognitive symptoms of depression include, pessimism, negative self-perceptions, decreased memory and attention. Attention's a big one. You see a lot of distractibility, and sometimes people confuse depression with ADHD because of the distractibility. But the cognitive symptoms, you can have a whole host of memory and attention factors that are adversely affected. And then lastly, the 5th kind or symptom of depression are physical symptoms. So people who are depressed might somatize their depression and report headaches or indigestion, constipation, physical aches and pains. They might have changes in sleep. Now, when it comes to depression, the changes in sleep can be a marked increase or a marked decrease in sleep. And then appetite and eating. Some people have an increased appetite due to depression. Some people have a decreased appetite due to depression. So you'll see considerable weight gain or weight loss as a function of depression. So I know I said a lot, but here are the 5 general categories or domains of depression: emotion, motivation, behavioral, cognitive, and physical. I like to put it on this slide so it's a visual so you could see it all at the same time. Now, a person meets the criteria for a major depressive episode or a major depressive disorder. Now we have to specify what are the qualities of this depression. And the classic course specifiers are mild, moderate, severe. We also have with or without psychotic features. And we have in remission or partial remission, which means that it's starting to go away, or unspecified when we're like it doesn't fit one specific criterion. Now, additional subtypes of depression that we specify are whether it's major depressive disorder recurrent subtype or single episode. I know we keep talking about this, but in order to have a recurrent subtype of depression, you have to have at least one prior major depressive episode. If you have no prior episode, then you are going to do major depressive disorder single episode. That would be how you would specify the condition. We also understand that a person can have a seasonal onset of major depression, but in order to diagnose a person with a seasonal onset of depression, you have to track at least 2 years worth of data. So you might have heard the popular phrase seasonal affective disorder. In the DSM, it's really major depressive disorder with seasonal onset. But if I want to say that people have the winter blues, well, then they need to have the winter blues at least two separate years consecutively for me to say this is a pattern. But if it's 1 year, we can't say it's seasonal onset. So we need to be able to track it. And I will say that we say seasonal onset because even though some people have the winter blues, it is possible for people to have the summer blues as long as it's consistent for multiple years in a row. We also have a catatonic subtype. Catatonia we'll talk a little bit more about when we talk about symptoms of schizophrenia, but it also, we see it with mood conditions. So catatonia, a person can be immobilized or almost like frozen in time, or they can have excessive motor activity. So when you see that catatonia or catatonic state, you want to specify that. That's important. We also, people might have heard the phrase postpartum depression. Well, we keep track of that. It really is either peripartum or postpartum because a person can start to feel depressed during their pregnancy, but we use the with postpartum onset phrase if the symptoms emerge within 4 weeks of giving birth. And then in terms of melancholic subtype, we use that if a person has anhedonia and is totally unresponsive to pleasurable events. So these are the subtypes of depression. And now let's look at the epidemiology. How frequent does it occur? And if we look at different communities, are there any differences? So if we look in the United States, roughly 9% of adults in the United States suffer with unipolar depression. And there's another 5% of people who have more milder forms of depression, but might not meet the criteria of a major depressive episode or major depressive disorder. Now, across the lifespan, it's about 19% of adults will experience at least one bout of depression in a clinical sense. And if we were to compare the United States relative to other countries, the prevalence is fairly consistent. Canada, England, France, and many other countries have a very similar profile when it comes to this diagnosis. We do see that people who live in poverty have significantly higher rates of depression than wealthier individuals. And it's possible that that's due partly due to the additional stress factors that a person experiences while living in poverty. We also see that depression occurs across the lifespan. So people of all ages are vulnerable to depression. There are gender differences. Women are typically twice as likely to experience severe depression relative to men. So if we look at the lifetime prevalence, it's about 26% of women and 12% of men who report depression. And then when we look at children, actually that difference doesn't start as wide. The prevalence is fairly similar among boys and girls at a younger age. And in terms of treatment, 85% of people who experience depression will recover. So there's a large recovery rate. And I will add that some of these people who recover, they recover without professional help or without treatment. That being said, research suggests that treatment increases quality of life over people who don't receive treatment. And then in terms of recurrent subtypes of depression, that specifier was important because we know that roughly 40% of people who experience a single depressive episode will experience an additional episode in their life, if not more than one additional episode. So that is major depressive episodes and major depressive disorder in a nutshell. But what I like to do, because I'm a clinician, is I also like to show you an instrument that we use in the field to help assess or screen for major depressive disorder. So give me a second and I will pull that up. So what we're looking at here is what's referred to as the Patient Health Questionnaire. It has 9 items, hence why the abbreviation is called the PHQ-9. And we are basically doing a quick screen for depression. And we ask the respondent to report in the past 2 weeks, how often were they bothered by the following problems or symptoms? Now, that 2-week indicator is important because I said to you, for a major depressive disorder, you need to have at least 2 weeks, most of the day, if not all day, experiencing that. So what we do is we list 9 features of depression, such as loss of interest and pleasure, feeling down, depressed, hopeless, difficulty with their sleep patterns, loss of energy, change in appetite, feeling as though they're a failure or let the family down, having difficulty concentrating, might have that catatonia, slow speech, or fidgetiness or restlessness, and then suicidal ideation. So we screen all 9 of these. We add up and we get a total score. And then, just to give you a sense of how we make a determination on the specifier, if the person's score is 1 to 4, we consider that minimal depression. 5 to 9, it's more mild. 10 to 14, it's moderate depression. By the time it's at a moderate depression level, we consider it an issue. We consider it a significant clinical issue. And most insurances by that time are going to pay to help you get better. Sometimes if it's minimal or mild, you might have some pushback from insurance companies. But moderately severe is 15 to 19 and 20 plus is severe. So it's on a spectrum, right? And then we would use that specifier. Now, this is a quick screen. There are only 9 items, but I mentioned to you, remember how there are all these different domains: physical, emotional, cognitive, etc., motivation, so forth, and behavioral. Those 5 domains, you don't see every symptom of depression here. If you want, there are other instruments such as the Beck Depression Inventory, which does a great job at tapping into some of the physical and cognitive features of depression. The CESD, the Center for Epidemiological Studies measure for depression, is pretty good. So there are instruments that have more items and can, flesh this out further, but this is a rudimentary screening instrument. So that is major depressive episodes and major depressive disorders. I hope you enjoyed this video. If you found it useful or informative, hit the like button, subscribe, click the notifications tab so that I can continue to provide these informational sessions to you and help the information go to a broader audience. I will continue the next video on persistent depressive disorder. That's likely going to be a shorter video, but stay tuned. Thank you, YouTube. I will see you again next time.